Dear students and my dear viewers, welcome back. In the previous session, we have discussed about the kinematics of spine. The kinematics of spine is one of the function of the spine, which describes the mobility or description of motion. Now, in this session, we are going to discuss about another function which is called as stability of the spine. The stability of the spine can be discussed in the kinetics of spine. So the kinetics means, what are the forces, what are the forces which are involved in the spine to get stability during motion and also during at rest. So what are those forces which helps in stability? Those things we are going to discuss under this kinetics. So normally how can you identify that a spine is having stability? If you are sitting or standing or you are in any posture, some sort of stiffness is developed along the vertebral column. So here the stability can be studied as the stiffness of the vertebral column is the column's ability to resist an applied load. Stiffness can be represented graphically by the slope of stress and strain curve. So this is the stress and strain curve. We have already studied in joint structure and functions, that is the mechanical properties of the structures, joint structures. The steeper the slope, so if you can see the steeper, so this one is like this, the steeper is the slope of the curve, the stiffer the structure. And the complexity of the column is made accurate determinations of both the stiffness of the column, so entire column, stiffness of the entire column as a whole, and the contributions of various structures to stiffness is very difficult to obtain. So the stiffness of the column as a whole is easy to determine, whether if you take the individual structures. So for example, the vertebral column is maintained by a number of factors like the ligaments, and the joints which are present in between each vertebrae plays a very important role. So those structures contribution is also helps in the formation of the stiffness in the column. But as a whole, the stiffness can be studied very easily than if you can study each and every mobile segment is somewhat difficult. But researchers investigating the spine have used small segments of the column called mobile segments or motion segments to determine stiffness. So they used to study, they have taken a mobile segment with that of its intervening tissues or intervening soft tissues, like so here one mobile segment is there, and also it is having the ligament, soft tissues are also present. So like that they have taken, and of course this one is the transverse longitudinal section of the vertebrae we can see. So because of that we can't find the zygapophyseal joints here. That one is also considered in this mobile segment. So So a motion segment consists of two adjacent vertebrae and the intervening soft tissues. By applying a specified load to the motion segment, an investigator can determine the stiffness of that particular segment. And they used to remove one of the ligaments one by one. So they first removed this anterior longitudinal ligament, and they test for the stiffness. Okay, how much stability can be get by this segment if you remove anterior longitudinal ligament. After that, they kept anterior longitudinal ligament, they remove posterior longitudinal ligament. Like that, they used to remove one by one these soft tissues which are giving support to the motion segment, and after that they used to investigate how much stiffness is developed in this mobile segment. And also after removing all the ligaments, they went and checked for removing the joint capsules, and some portions of the discs are also removed, and they used repeated measurements of stiffness, okay, to assess the hysteresis and creep of each attempts to assess the stiffness of the spine. Okay, so these are the things happened to study the stability of the spine. Okay, so finally Punjabi has used the size of the neutral zone to provide a clinical measure of spinal stability, which is very, very important. That is called as neutral zone. So neutral zone. So the neutral zone is the range of motion through which the spine can be displaced from a neutral position to the point at which elastic deformation begins. So here in this load deformation curve you can find this thing. So this is the starting point, and this up to A, O to A, this one is called as neutral zone, that is toe region. Toe region is considered as the neutral zone. So what will happen in the toe region? So if you take so this one is the collagen fibers of the ligament. So the shape of the fibers of this collagen fibers at this stage, at the level of neutral zone, is it is in the form of crimp shape. So that means the fibers are like this. So once it reaches to the, so up, if you increase the load from 0 to up to this position, so slowly the crimp is going to be removed, and it forms some sort of straightness of the fibers will occur. So once the straightness of this fibers occur, so some sort of stiffness developed, okay, and that region is the point where the elastic property or elastic deformation begins. When a small load is applied, so now the fibers are going to show its elasticity property, or elastic deformation is going to take place from A to B. This is the next stage. But this Punjabi investigator has taken this neutral zone as clinical measure. Okay, so clinical measure to find out the spinal stability, and he suggested that the existence of large neutral zone indicates instability. So if you see this stress and strain curve, the toe region or the neutral region is very small. If the range is increased, okay, if the large neutral zone, so for example up to here, this one is toe, it may be increased up to here. So this some sort of this neutral zone. So that means we are applying load here. So up to 30 also this neutral zone is present. Then we are increasing the load, but the stiffness is not developed. So what is happening to that one? So still it is like this. So the structures are not able to accept that force. Okay, so what will happen? Instability takes place. Okay, instability of the vertebral column can be considered as lack of stiffness. So instability, very very important, instability of the vertebral column can be considered as lack of stiffness, and an unstable structure is one that is not in an optimal state of equilibrium. When the vertebral column is unstable, it exhibits a greater than normal range of motion. Okay, when the vertebral column is unstable, it exhibits a greater than normal range of motion. Okay, this thing you have to keep it in mind about this neutral zone. So if the neutral zone is increased, instability of the vertebral column is present. Okay, next we will move on to next thing of kinematics, that is the spine or the vertebral column is subjected to the following forces like axial compression, bending forces, and torsion, okay, and shear forces, and this one is the torsional forces. So these are the 4 types of forces which are subjected by the spine, not only during normal functional activities but also at rest. Okay, and the column's ability to resist, okay, these loads varies among different spinal regions. So cervical spine, thoracic spine and lumbar spine may show different kinds of ability to resist these loads, and is dependent on the type of duration. These forces are dependent on the type, duration and the rate of loading, and also the person's age, posture, and the condition and properties of various structural elements like vertebral bodies, joints, discs, muscles, joint capsules and ligaments, and very very important thing, and the integrity of the nervous system. All these things are going to affect these forces. Okay, now first we are going to discuss about axial compression now. Yes, axial compression. So here the force acting through the long axis of the spine. So the force is acting through the long axis of the spine at right angles to the disc. Okay, at the right angles to the disc. So here you can find the disc. The force is acting like this, and this is the disc. So here you can find the right angles to the disc. The force is acting right angles to the disc, which occurs due to, so this force, the axial compression maybe occurs due to force of gravity, gravitational force, and the force is produced by the ligaments. Okay, the ligaments also attached in the longitudinal aspect, isn't it? So the ligaments and the muscular contractions. Most of the compressive force is resisted by the discs and the vertebral bodies. Most of these forces are resisted by the discs and vertebral bodies. But the arches, here you can see, but the arches share some of the load in certain postures and during specific motions. Okay, the compressive load is transmitted from the superior end plate to the inferior end plate superior end plate to the inferior end plate. Here you can find superior and inferior end plate of each vertebrae. So this one is transmitted through the trabecular bone of the vertebral body and the cortical shell. So here at the periphery we can find the trabecular bone and the cortical shell. Okay, the cancellous body contributes 25 to 55% of the strength of the lumbar vertebrae and under the age of 40 years. So here the cortical bone in the lumbar region will take 25 to 55% of the strength of, okay, at the age of 40 years. And after 40, the cortical bone carries a greater proportion of the load, okay, as the trabecular bone. Okay, so after 40, the cortical bone is going to carry more amount of force than the trabecular bone. Okay, yes. Why? Because means the trabecular bone compressive strength and stiffness decrease with decreasing bone density. So the bone density after 40 is going to decrease. So the compressive strength is take over by this cortical bone. Depending on the posture and region of the spine, the zygapophyseal joints carry some of the loads in compression from 0 to 33%. The spinous processes are also share some of the load when the spine is in hyperextension. During hyperextension, what will happen? Both the spinous process of the adjacent vertebrae are going to contact with each other. So in that case, what will happen? Some of the forces are transmitted from the superior spine to the inferior spine. Spinous processes. Okay. Yes. So now, so we have already discussed about this compression of an intervertebral disc in the intervertebral disc video. Okay, again we will see the thing, what is happening here. So the nucleus pulposus, so here you can see the nucleus pulposus acts as a ball of fluid that can be deformed by a compression force. So this one is a schematic representation. At A, it is having a small round ball in the middle of the annulus fibrosus. Okay, this one is normal. And if you see in the B, some compressive force is acting. Okay. So the pressure created in the nucleus actually is greater than the force of the applied load. When the weight is applied to the nucleus pulposus from the above, the nucleus loses its height. So what is happening here? It is losing its height. So here the height of the disc is more when it is in normal condition. Once the force is applied, the height of the disc is reduced. That is the first thing which is happened. So first it loses height and it exhibits a swelling pressure and tries to expand outward towards the annulus and the end plates. So it is going to expand towards like this and also towards the end plates in all directions. Okay, and what will happen now? So as the nucleus attempts to distribute the pressure in all directions, stress is created in the annulus. So for every action there is an equal and opposite reaction is there. Okay, in the nucleus pulposus the forces are created in all directions, and the annulus, the stress which is created in the annulus and the central compression loading occurs on the vertebral bodies. The force of the nucleus on the annulus and the annulus on the nucleus form an interaction pair. So it is the annulus is going to give an equal and opposite force against the nucleus pulposus and forming an interaction pair. Normally, the annulus and the end plates are able to provide sufficient resistance to the swelling pressure in the nucleus to reach and maintain a state of equilibrium. The pressure exerted on the end plates, okay, here the pressure exerted on the end plates is transmitted to the superior and inferior vertebral bodies. Okay, so whatever the forces acting on here at the end plates are transmitted to the superior and inferior end plates. Vertebral bodies. The annulus fibrosus is under tensile stress and thus is able to better resist the compressive load. The discs and trabecular bone are able to undergo a greater amount of deformation without failure than the cartilaginous end plates or cortical bone when subjected to axial compression. The end plates are able to undergo the least deformation and therefore will be the first to fail under high compressive loading. Okay, the disc will be the last to fail. So whenever there is an high compressive forces or high compressive loading occurs, the first part of the mobile segment you can take the structure which is going to fail is the end plates. So where the fracture is obtained at the end plates of the vertebral bodies, and at the last the vertebral discs are going to rupture. Okay, so this or the things happened during axial compression. And another very important thing regarding axial compressions, or when the discs are subjected to a constant load by forces that are not large enough to cause permanent damage, the discs exhibit creep. Okay, so under sustained compressive loading, such as a person standing in the upright posture, the rise in the swelling pressure. So what will happen in the upright posture? There is a swelling pressure. Okay, increase in swelling pressure. So what will happen now? The fluid which are present inside the nucleus pulposus and the annulus fibrosus are going to move outwards, okay, through the small pores which are present over the discs. Okay, so the amount of fluid expressed from the disc depends both on the size of the load and the duration of its application. So the expressed fluid is absorbed through the microscopic pores in the cartilaginous end plate. Okay, so those are the small pores. When the compressive forces on the discs are decreased or removed in the recumbent position or absent in weightlessness, so the disc imbibes fluid back from the vertebral body. So whatever the fluid which enters into the vertebral body during pressure, again after removal of force, those fluid is imbibed back by the intervertebral disc after removal of some load or compressive forces. Okay, so the recovery of fluid that returns the disc to its original state explains why a person getting up from bed is taller in the morning than in the evening. It also explains why an astronaut returning from the weightlessness of space is taller on his return than on his departure. And also in the elderly, the amount of creep that occurs is greater than in the young, but the recovery from creep and hysteresis is slower. The loss of height that occurs as people grow older is due to the fact that the nucleus loses a large proportion of its fluid imbibing capacity with aging. So these are all the things about axial compression. In the next session, we are going to discuss the remaining forces, that is bending, torsion and shear, in the next video. Thank you.